All right, welcome back to AI plus Data Mastery, where we explore how AI and data are reshaping B2B businesses while at the same time accelerating innovation. Quick shout out to our sponsors, Data Accelerator and Evolve with AI. We appreciate you immensely. Thank you so much. And I'm your host, Jason Reno. And today I'm excited, right? Because we got like a double dose of B2B and AI here. So I'm joined today by my guest, Sharlene Jerome with Sensoria Health. Welcome to the show, and thank you for being here, Sharlene.
Hey, Jason, thank you so much. Thank you for the invitation. I'm really excited. Anytime I get to tell the Sensoria Health story is a great day for me. So fire
Perfect.
away.
Yeah, and then I was on the website. It's the reason why I was excited is because obviously the show's around AI and data with the focus on the B2B industry,
Right.
and you guys kind of check all the boxes because your market is the B2B market. You have a health and rehabilitation product tied to AI, which is another topic of the show. So it's like we're kind of hitting hitting on both notes there, if you want to call it that. So can you give us a little bit of just a brief kind of background, what led you to being the marketing manager at Sensoria Health, and then maybe a little bit of background about the company and, kind of what problem are you solving in the world today?
Yeah, absolutely. Actually, back in, I think it was 2014, I read an article in Seattle Business Journal, which talked about Sensoria. It was just a little half article, and it was talking about we were then focused on just like the fitness area, not Sensoria Health so much, but and it talked about these wearable socks, these smart socks. And I said, oh my God, I told my now husband, I said, honey, I have to work for this company. And he said, well, nothing pays like persistence. And so over the course of the next couple of years, I was able to meet with Davide and take over for the then marketing manager, Paulo Schiera. And then I've been with the company ever since. It's been a journey. Let's put it that way. There's been some ups and some downs, of course, as with any new company. I've never worked in the entrepreneurial space before, so this was a new endeavor for me. But yeah. And then the work that we're doing with Sensoria Health has been even more inspiring than what we did in the fitness industry. So that's kind of how I ended up here.
Yeah. So with Sensoria Health, can you tell me, a little bit? Obviously, neither one of us are the techie side of our company. So without getting into too much detail, can you tell me a little bit about or maybe even just keep it high level, like what problem are you guys solving in the health and rehabilitation space?
Yeah, absolutely. So we're mainly focused on the aging population, which, as you know, probably is growing by leaps and bounds, and there's not enough clinicians, physical therapists, et cetera, to meet the needs of this growing population. And so what we wanted to do was we want to expand the reach of the clinician through AI, through sensors, through technology, things of that nature. So we don't ever want to replace the clinician, but we want to have them be available to agentic AI solutions that will take care of the administrative part of their job so that they can then really focus their time on the patients that need their attention the most. So what we have developed is really this platform approach. So we never wanted to create a silo product. We knew that the opportunity is much bigger if you can create a technology platform, which we have using this little device right here. This is Sensoria Core. It's a 9-axis IMU. So it has an IMU, inertial measurement unit, which includes an accelerometer, a gyroscope, and a magnetometer. So we can literally see movement in space. Wow. One of the challenges we found early on was that we went to the marketplace to find sensors to put in the garments. Our vision has always been the garment is the computer, right? So we wanted to inject this sensing technology into the garments, coupled with a piece of microelectronics to, i.e., make them smart. We couldn't find those sensors, so we're crazy enough to develop our own. So now we have our own proprietary textile pressure sensors, and we created this device, Sensoria Core, from the ground up. We also have customized mobile applications per product because we're measuring different things. So we have to have customized mobile applications. And then we house everything in the Microsoft Azure HIPAA compliant cloud infrastructure, where we have created like a clinician dashboard. And Jason, the dashboard is color coded. So it's like red, green, red, yellow. And so green are the good guys. So Jason, your clinician says you need to do X, Y, Z, and you do it daily without any problem. And then on another day, Jason, you're in the yellow frame because you're in and out of what they determine are ranges of normality. And then the red guys are the guys that are, for some reason, not doing what they need to do, whether it be, is it too painful? Do they not remember? So we track activity and adherence across a wide range of healthcare scenarios, but that's kind of like the full stack. So sensors plus microelectronics plus mobile plus cloud.
Now, when you say mobile too, because our viewers right now, they can't see the website,
Oh, sure.
or if somebody's listening and they can't see the website, but when you say mobile, you're meaning you're putting those sensors into a wearable application. So like I'm on the website here, you have like a boot for ankle, you have, it looks like knees, and I'm assuming other, sensors or garments for other joints. So that's what you mean is somebody can put on a boot, do the exercises that physical therapy or that clinician had recommended to them. That's all censored and monitored so they know it's done without that clinician or without somebody having to go to a doctor's office or that person coming to there. It's all done remotely and monitored.
Yes, but the mobile app is literally a mobile application. So whether it be on Android or iOS, so we actually have customized.
I thought when you meant mobile, like you were meaning like that sensor was being embedded into like a wearable garment to make it mobile.
so it is. So I'll show you the Sensoria Smart Socks. So these are the proprietary textile pressure sensors. They're in the first and the fifth metatarsal and at the heel. And then the microelectronics connects at the ankle bone level. And then this connects wirelessly via Bluetooth to a customized mobile application. But yes, we have injected the sensing technology into these products.
So if your part of your rehabilitation was to walk, move, do anything, that would be censored and monitored, and that information is then relayed back to the clinician or the healthcare professional.
Exactly. You're 100% correct. Yes. And then they can monitor, they can look at the data when it's convenient for them. So you don't have to be, it doesn't have to be like we have a meeting today scheduled at 11:30. If you wanted to look at you as a clinician wanted to look at the data at 7 p.m., you could do that and then follow up accordingly with the patient, depending on whether they're following their clinician protocol.
It really is a higher level of care because like my dad, for example, needed an in-house rehabilitation a while back. And it's like, he was approved for like one visit a week. And then it's like, hey, do these exercises each day. And it's just like 50-50 if my dad did them or not, it's like, who knows? And then the guy shows up the next week and my dad probably BS's him. And it's like, oh yeah, I did it all. No problem. Feeling great. And it's just like, actually you didn't do anything, and,
Absolutely.
So it's
quantified data versus self-reported data. We do have self-reported data as well, but it's the same thing. People underestimate the amount of exercise that they did, and they underestimate the amount of calories they take in. They overestimate the amount of activity that they actually do to burn those calories. So that's kind of. But yes, so we are remote patient monitoring wearables and software solutions that help improve people and patients' lives.
Is it just, I know you mentioned the aging population, but I mean, it sounds like it's just not for aging population, athletes with sports rehabilitating injuries. Yes. I mean, it's across the board, correct?
Sure. Yes.
You can have that fancy orthopedic surgeon flying to LA, do the surgery, put the knee brace on him and then monitor him from his house back in Chicago, hypothetically, or whatever the case is.
Yep. You got it.
It's pretty cool.
It really is.
So tell me a little bit about your role there as the marketing manager when it comes to, obviously you have AI and all these cool tools. Your target audience is the actual healthcare professionals, the brick and mortar type of places, whether it be hospitals, clinicians,
wound care clinics, things of that nature.
Wound care clinics, that's what I was trying to not the smaller clinics, but like I'm brain farting right now. The urgent care, that's what we call it here in California, urgent care. So any of those places is your target audience, right? Your addressable market.
Yes. So
what are some of the challenges that you're facing right now, addressing that market and getting in front of them and making people aware of this, amazing product that could.
You just hit on the top. You just hit on the top down awareness. Brand awareness is our number one challenge, right? Especially for a marketing manager, reaching the decision makers. And there's a lot of times where, larger organizations, they go through reorgs. So, we're talking to the right person, and then all of a sudden somebody leaves, and then you start from the ground zero, and then you need to build a new relationship with that person. And sometimes it just doesn't always transfer the way in which that one would hope. But we are very lucky because we have such great strategic partners that we rely on as well. So for instance, we do have a diabetic foot boot. Defender is the company we partner with there. They're based in Florida. So they make the boot, and then we make it IE Smart. And so that boot is going through an R01, which is a NIH grant with the top two podiatrists in the world, Dr. David Armstrong at USC Keck School of Medicine and Dr. Bijan Najafi at now UCLA. He was at Baylor College of Medicine. That's been going on for 5 years now. So we are clinically validating that our smart boot is better than the gold standard, which was a total contact cast. And so, yes. So a total contact cast sounds exactly what it is. It's a cast. You can't remove it. Every
That's
week.
old school, wrap it up with the plaster cast, right? Yeah.
Yes, right. And they would have to go back to the doctor's office weekly to take the cast off, to check for the ulcer, to see what's happening there, right? And then you need to recast the person every single week. So that's just A, inefficient. B, you need a special person to do the casting. C, it's not comfortable for the patient. So we are literally,
plus it's uncomfortable stuff.
right. Yeah. So we're actually improving outcomes so that our 01 study is showing that our sensor we call them removable cast walkers. So the sensor removable cast walker is actually better than the ITC, the total contact cast, for outcomes as well as quality of life. Just across the board, it helps reduce the risk of reulceration. It helps the patient heal faster. And again, just improves the quality of life. And there are actually 4 levels of reimbursement for this device. So from a Medicare perspective, it has an L code. That's number 1, which varies by state, but it's around $350 for the reimbursement of that boot. There's also CPT codes. So these are remote patient monitoring codes that you can bill for the device, you can bill for the setup, and then you can bill for the clinician actually reviewing the data of the patients, $20 or $40, depending on whether they need to be reassessed. There's also a MIPS incentive, which is a value-based incentive award. And so this is in line with the clinician doing what they said that they were going to do, right? And so, and now there's even a fourth, sorry, cut that. Sorry, I forgot the 4th level.
No, don't worry about it. So, I mean, that's all. I mean, obviously, some of it's like kind of health jargon that's going over my head. But my question then is how are you getting like those results, that information to those potential prospects so they know about this amazing product that's out there coming into market that they have available to them? I know we had touched on, I think the founder was going to a trade show, but what else are you doing for marketing? Are you trying to run Facebook ads? Are you doing some email marketing? Kind of what's working, what's not working?
Yeah. So we actually have a Spotify channel called Beneficial Intelligence. So we don't say artificial intelligence, actually beneficial intelligence. And so we probably have 7 or 8 episodes out there right now. We do a lot of LinkedIn. So that's been our biggest bang for our buck. So not LinkedIn ads, just LinkedIn postings where we go in and engage with people. Defender has a small sales team, so we rely on their sales team to help get the word out about the smart boot with that company.
Okay, gotcha.
So, and then we do some email marketing. We just did a webinar with those 2 professors I mentioned before, Dr. Armstrong and Dr. Najafi. So we had over 200 clinicians on that webinar. So that's how we're getting the word out.
Nice. Very cool. And then as far as without discussing numbers or anything like that, are you seeing like in 2025 here, have you seen a steady growth? Is the efforts working? Is it paying off?
Yes. The year-over-year growth is working. Yes, that's about all I can say for just proprietary. We're a private company, so but yes, we're on the right trajectory. Let's put it that way. So
you're going up. You're going upwards, not down.
Right. Yeah. Exactly, and not stagnant. So that's good.
Which the reason why I ask is because a lot of I'll talk to people in your position and be like, yeah, we're doing all of this, or we're trying these different efforts, but nothing's working. We're down 3% from last year, or we haven't had any new cash collected in a few months now, or something along those lines. So, but glad to hear it's working out. Where do you see, I guess, in terms of staying along the track of AI, where do you see from a marketing standpoint, not the actual boot itself,
right?
But have you explored different AI tools, data tools? Have you tried pulling physician lists from a Zoom info? I mean, where do you see AI and data possibly being incorporated or solving some of these problems for you in the future?
Yeah, I mean, I think we're using that component to find the right decision makers to reach out to. So that's the main part that we're using artificial intelligence. I mean, of course, I use it to help me write some blogs, things of that nature. Just getting the right twist on those. But we don't invest in buying list or anything like that. So it's just it's just using the tools that are available to us to get kind of making the message really resonate with our target customers. I can do that mainly on my own, but still like to use AI to kind of verify.
AI puts a little sparkle on it,
Yeah, exactly. Yeah.
Yeah, no, it's remarkable. I mean, and I know a lot of people use it like surface level like emails and that type of stuff,
Sure.
but it's insane what's going on right now in terms of all the tools being built. Like you had mentioned even the Defender has their own like sales team to reach out to people, but in the near future, if not now, you can have your own AI SDRs that email and text and communicate with people. You don't have to hire a sales team. It's a few different AI people a few different AI agents funneling them into a one specific kind of closer, customer service rep, things of that nature.
Sure.
Are you doing any type of like SEO or any type of other like digital marketing efforts to attract people to your site?
Yeah, we have some keywords and things built into our website, but we're not working with any like specific SEO company. So at the moment, so we just did a website refresh a couple of months ago. So we're kind of trying to track and see how we're doing on our own before engaging an outside agency to see what's up.
Wonderful. And then I guess, what is the we're in Q4 right now going into 2026. As a marketing manager, what's keeping you up at night right this second?
Let's see. Well, we're looking to do a Series A round this year. So that's key. And that would help us to open up some other marketing and sales opportunities in 2026. So that's what I would like to see. But
gotcha. Then that would allow for some more, budget into some more opportunities to get into
and some more trade shows and just better, more awareness at different levels. So, but I wouldn't say it's keeping me up at night.
No, when I say that, it's just kind of like what's bugging you, what's eating at you. Like, oh, I wish I could do this, or I wish I could do that, or I wish this was available. That was kind of along those lines. And then as far as Sensoria Health, it goes in terms of like, are you guys looking to expand into more? I know you mentioned the boot and things of that nature. Are you expanding into more? I don't know. I know boots and ankle, but elbows, shoulders, like in a full body type of sensors and application?
Absolutely. So we have actually, if you go to our developer website, sensoria.io, so sensoria.io, you will see our Sensoria. We call it Sensoria Developer Platform for the SDK because we have software and hardware. So we don't say software developer kit, we say Sensoria. So the cool thing is people come to us with their problem and they say, can you create something to help me solve the solution? So case in point, Rancho Los Amigos National Rehabilitation Center in Downey, California. They I'm working with one of the PhDs there, Jeff Ranking, and he came to us. They're a county hospital, so they don't have budget. So we did this pro bono for them, but they said, hey, this technology, so they do a lot of work with spinal cord injury patients. So what you may or may not know is spinal cord injury patients, because our bodies are just not designed to sit for hours and hours a day. So they need to do what are called pressure relief activities. So think like lean right, but you need to be able to lean far enough to get the blood circulating in the buttocks area. So our mobile application, reminds them to do their exercises as well as calculates the quality and the quantity of the exercise. So if they don't lean far enough, they don't get credit, right? So, and then our sensors are so we actually have two offerings. We can do the full cushion ourselves with the sensorized insert. So again, the same sensors that are in our stocks that I showed you earlier, there are 4 of them placed strategically to be able to monitor these leaning activities. And then, or if they have their favorite cushion, which most people on a wheelchair have a favorite cushion, we can inject that sensor layer, the insert, and they can use their own cushion, but then we still are able to monitor their activity. So we did that for Rancho. So, and we're still in, we're still in the cahoots with them to do more things. So that was a 5-year NIDLR grant that we received with them to validate the smart mat. And
wow, nothing moves quick in that space, huh?
Yeah. No.
Well, I guess if you need government approval for anything,
Right.
or those type of approvals or whatnot, nothing's going to move fast.
No, absolutely. And then we probably have another 5 prototypes in the work that I'm not able to discuss at this time, obviously, but in conjunction with the products that we've already brought to market. So people come to us, honestly.
Gotcha. So healthcare companies will come to you, or healthcare practitioners will come to you and say, hey, I have this problem. I could really use this type of product to monitor this during my process, and then you guys can customize a solution for them.
Or so we're also working with Shepherd Center in Atlanta, Georgia. So they're using our smart socks for progressive MS patients, so multiple sclerosis patients. And so we're working with them as well.
Thank God I'm not in the health space. I don't pronounce words, the long words very well. I would get tongue tied like crazy. Well, amazing. I mean, it's just crazy where AI is going. And I mean,
yes,
like literally we have AI socks now. Like if you want to break it down like that can monitor everything that you're doing, which is just remarkable. And then, yeah, from the B2B standpoint, I mean, you're not alone. I mean, I think every B2B business is in that, like we discussed in the beginning of the call. I was doing some research before another show the other day, and where your average B2B business only is exposed to 10% of their TAM, of their total addressable market. So, I mean, in your case, I mean, Jesus, between healthcare and hospitals and everything else, let's just call it, you guys probably have an addressable market of 10 million, give or take. And I could probably guarantee there's not 1 million positions right now, even 10% of your total addressable market, that know about you. And that's really common in that B2B space. How do you get over that hurdle and get in front of the right individuals, to gain that exposure that you need? Because if they don't know about you, they can't really do business with you, right?
Exactly. Absolutely. 100%, Jason.
Well, you're not alone. That's a common quirk in the B2B industry for sure. But as we wrap up here, I always like to ask one final question is, what's your favorite book? I mean, I think most business professionals are reading, whether it's online and like myself, listening to an Amazon book. But what's one book that you've read or listened to that really stood out that has helped you in your career?
Not sure it's helped me in my career, but I'm reading the Andre Agassi book, which I know came out like a decade ago, but his autobiography. And so it's helping my tennis game, but I'm not sure it's helping me in business.
Hey, but I'm sure there's a tennis player or two listening, but that works.
Yeah, hopefully. So yeah, very, just inspiring, I guess. Yeah. So.
Yeah, his story is pretty, somebody else had mentioned that book a while back. It's like you said, it's been out a while.
Yeah, like at least a decade. But yeah, I'm slow to the mark to pick that one up. But yeah.
So is it actually a book about tennis, like tennis tips, or is it a book about Andre Agassi and his life?
It's about him and his life, but I have been watching tennis for years and years and years. So I actually remember, like, not to the degree that he remembers matches, but I'm like, oh yeah, I remember when him and Jim Courier were, this, and then he got really upset that Michael Chang won a Grand Slam before he did, and just like his whole, brain and everything else, and how he, he grew up, his father made him play tennis. Like, he hated tennis, and it was all about his how do you overcome these things and enjoy the tennis that you can produce in the life that you have. And I just think, like, I just watched him coach the Laver Cup, and it was just so, he's amazing. Like, just the way that he inspires his players, the way that he and Steffi Graf love one another, the way that they don't pressure their children into doing a sport that they don't like. His son's playing baseball, and his daughter, I think, she's either a dancer or an actress or something, like, so, or their daughter, their son. But yeah, it's really cool. It takes you back down memory lane, to some degree.
That is really cool. It sounds like you've been I remember, I'm 45, so I remember Agassi growing up like as a teenager, but it's, I was never really a tennis fan, but he was always cool. I mean, he had the Nike sponsorship. He had the bright kind of gear and whatnot. Like, it was like he kind of, help make tennis cool there in like, what is it,
Right.
in the early to mid 90s or cooler, like Tiger Woods did for golf. But awesome. So Andre Agassi, I'll have to check that one out and listen to it on a plane ride or
Yeah,
sauna
there
or
you go.
something along those lines. But
Yeah, isn't that
wonderful.
great? We took my husband and I, we go to Seattle every summer, and so we drive from Arizona up to Seattle, and so we really love audiobooks. Like they're just amazing. It passes the time so much better. So yeah, that's a great
Yeah.
tool. I know that's been out there for decades too, but
yeah, I admittedly haven't actually read a book in a very long time, but I'll whether I'm like at the gym or in a sauna or driving, driving my kids all around
Right.
Earth, it feels like it's,
Yeah.
driving them around, I'll listen to a podcast. But yeah, a lot. And what I like too is like you can, the books are obviously, you can obviously listen to them, but with the podcast, you can find like a nice 20-minute episode. You're like, hey, I got 3 hours to kill. Let's jump on Joe Rogan and listen to him ramble for a few hours, or, you can kind of pick your poison, so to speak.
Yep. For sure.
Wonderful. Well, let's wrap things up here. I really appreciate your time. I think we could probably talk about your products. Obviously, you can't talk about some of the cooler things going on in the new stuff, but I mean, it's just remarkable what you guys are doing. It's phenomenal. I'm really fortunate to learn about it. Hopefully, the audience to kind of open their eyes a little bit to what else is going on. It's not just helping write an email, but it's literally helping people rehabilitate, heal, live longer, and just have better lives overall, right?
Absolutely. Yes. Well, thank you so much for having me, Jason. I really appreciate it. Hopefully this will help my brand awareness issue and go from there. So really appreciate you reaching out, and I thoroughly enjoyed our talk. So thank you so much.
Yeah, no, this was a great talk. We appreciate you too. And we thank everybody for tuning in the audience here. If you have any questions or you just want to check out some visuals of these cool products, Sensoria Health, it's SENSORIA health.com. And appreciate you tuning in. Don't forget to like and subscribe here on YouTube and follow us on social media. And we'll talk to everybody again soon for the next episode. Take care.
Sounds
Be
great.
well.
Thanks again. Bye.